Hello, my name is Jessica Bland. I attend Waynesburg University. I completed my presentation on violence in healthcare as it is a rising problem. The objectives of this presentation are to identify different types of violence, identify ways to decrease violence, learn how to deflect violence, implications of violence to healthcare facilities. The definition of violence is the use of physical force to injure, abuse, damage, or destroy. It can also be defined as intense, turbulent, or furious and often destructive action or force. The World Health Organization, or the WHO, states that 8 to 38% of healthcare workers suffer from workplace violence, with many more being threatened or exposed to violence. Please note that these are only the cases that have been reported. Many cases of violence in healthcare go unreported each year. Different types of violence in healthcare. Per NIOSH, Type 1 is criminal intent, individuals with no relationship to the business or its employees. Type 2 is customer, client, or patient violence. The individual has a relationship with the business and becomes violent while receiving services. Type 3 is worker to worker violence, also known as lateral violence, employees who attack or threaten other employees. And type 4 is personal relationship violence. This type of violence is individuals who have interpersonal relationships with the target of the violent act, but they have no relationship with the business. The Occupational Safety and Health Administration, or OSHA, shows the chart below that 80% of violence towards healthcare workers comes from patients. 12% is other client or customer violence, 3% from students, 3% from coworkers, other person not specified as 1, and an assailant, suspect, or inmate is a very small portion of violence in healthcare. Type 1 criminal intent. This type of violence would be a terrorist attack. Places are training their employees for chemical and weapon attacks. Lockdowns are practiced within healthcare facilities, as well as drills to keep patients, residents, and visitors safe if a chemical or weapon attack occurs. Type 2, customer, client, or patient. Violence towards healthcare providers is rising. Nurses have the highest rate of aggressive exposure of all clinical workers, possibly due to the type and amount of time that they are in contact with patients. Violence toward healthcare workers happens in every healthcare setting, including outpatient, inpatient, psychiatric, medical, and emergency. Healthcare workers can understand violence from a patient with mental health issues. Sometimes a schizophrenic patient hears voices telling them to harm others. In these cases, the healthcare workers must identify at-risk assailants. Healthcare administration is training healthcare providers on how to protect themselves by increasing active shooter training and violent situation diffusion techniques. Patient, family, and visitor violence towards healthcare workers. This occurs more often now due to restrictions from insurance companies. They're making it more difficult for patients and families to have the proper placement options that they need, and this is making patients and their families feel trapped. Increased substance abuse is also increasing the risk of violence. Many times we hear of emergency room patients who come in drunk or high on drugs and they become violent. Stress is on the rise and people are succumbing to that stress and taking it out on those who are attempting to help them. Recently, in the facility where I work, an ALS patient came in and his sister wanted him placed in an acute rehab facility. Unfortunately, he did not qualify for ARU as ALS patients should not be fatigued because fatigue can only exacerbate the symptoms of their disease. The physical and occupational therapists explained this to the patient and his sister. However, the patient's sister became aggressive towards the therapist and myself. We did have to get the nurse manager involved and the quality control nurse as well. Sometimes, in order to diffuse these situations, you have to get management involved. It makes the patient and their families feel like they are being heard and that their input is more appreciated. Type 3 worker to worker violence or lateral violence. Lateral violence refers to a pattern of workplace conflict in which confrontational behavior is targeted at one person by another employed at the same level of responsibility across time in a repeated instance of emotional, psychological, physical, or sexual abuse. Such behavior is intended to overtly, purposefully demean, humiliate, or diminish the victim's stature, resulting in social exclusion and marginalization in the workplace. This is the most unheard of type of violence. It is not necessary. It is wrong. As healthcare providers, we need to appreciate and respect one another. I do suggest that if you witness lateral violence, you intervene immediately and advocate for that new employee. The effects of worker to worker violence include personal effects such as PTSD and other related symptoms, anxiety, increased stress, and depression in the victim. The institutional effects are increased turnover rates of staff, increased costs to train new staff, staff shortages, and a bad reputation for the facility in the community. Type 4 personal relationship violence. This is uncommon in the healthcare industry. There was a case on the news recently. A domestic dispute occurred inside a courthouse, and the perpetrator actually followed the victim into the courthouse and opened fire on the victim and the employees at the courthouse. Some people feel that personal relationship violence is on the rise in relationship to the culture of violence, with violence in the media and on TV. Ways to decrease violence include identify aggressive behavior, understand the cause of violence, understand the type of violence, identify the perpetrator's motives. Prevention from management is very helpful. Report violence if you are a victim so that the situation can be rectified. With a patient, have a clear path to the exit. Question the perpetrator if the situation is safe for questioning, and always make sure that someone's with you if you are questioning a perpetrator. Please note the references that I use within the slideshow presentation. The textbook, Advancing Your Career, Concepts of Professional Nursing, briefly touched on lateral violence and how it has a financial burden to the individual facility.